This is the thumb spica. Indication for a thumb spica will be a suspected scaphoid fracture or navicular, jammed thumbs, dislocated thumbs, and perhaps maybe even a ulnar collateral ligament sprain. The measurement for this would be taking a 3-inch elastic bandage, place a thumb in the middle of it, fold, overlap. If it overlaps, 3 is fine, but if it overlaps a 1/2 inch or more, I like to trim it down. And I'll show you that when I get to that point. The length will be from the tip of the thumb, and again, 2 inches distal from the antecubital, or the 3-finger rule. Get that measurement. Cut it off. Push it back. Push the product back into the foil, into the box. Keep your fingers there until your door comes down and touches it, and then that way you know the product's behind the door. Pull your fingers out, reseal, and make sure that red seal is done. Make sure that red seal is gone now. Okay, that way you know it's sealed. And stretching these edges over the fiberglass by just grabbing both ends at the same time. Stretch, turn, and stretch. Or as an option, you can open it up, the double-faced tape, and just cut off the edges if you like. And that gives you some nice protection. So what I like to do is just take that extra, see that how much bigger that is? So I'm going to take a 1/2 inch away from the open side, the double-faced tape side here. Just open that up. And just remove about a 1/2 inch of fiberglass, just the length of the thumb. Okay. And then from this middle here, this section here, take a little V out of the middle of the fiberglass. Close it back down. Now removing some of the excess padding. Snip the middle of that V, and now you'll see when I apply it back on the patient, there's nothing here digging into the patient, nice and smooth, okay, and there's not much of an overlap. So it fits the patient much better than having a bigger piece. So now we're ready to wet this, and just taking your water bottle and just down the middle of the splint. Push that water through. Squeeze, place it back on the towel and just roll it down halfway, squeeze it. And what you're doing here is just removing the excess moisture from the padding, so that's important to do. Roll it up in the towel, squeeze. Place it back on the patient, taking that V right at the nail bed, so the thumb is protected. Now there's 2 ways of doing this. Traditional way, just a conventional radial gutter, or what we like to show is the slightly spiral it over the dorsal side of the hand. Okay, it seems to want to fall this way anyway. Just slightly spiral it, and just lock it in at the wrist with my bandage. Again, starting at the bottom, lock it in at the wrist. Come around. First wrap, and then the second one goes right to the very tip of the thumb. High, figure 8. If you go high, you should create a bridge here. That's okay, because the second one comes up, comes down low, eliminates that bridge, and now up towards the elbow. 50-50 coverage. Pulling on the splint, relaxing on the patient. But you want to watch out for its positioning. You don't want to have any other deviation. You want the wrist straight, okay, and not like this. So you want to have it straight, thumb to oppose the index finger. That's position of function. Wrist is slightly extended so it lines up with the shoulder of the patient. Thumb, radius, shoulder. And I maintain this position by just having the patient grab another bandage. That maintains that position for you for the first 3 to 5 minutes, and you're all set to go. And the reason for the V now is now I can fold back these corners that I made with my V to check my capillary refill. Thumb's protected, but I can still check my capillary refill. That's important to do.